Okay. Hello and good afternoon. Welcome to this final session and final formal session of the first day of the SPAGN conference. And this will be really the space and time to learn about some extraordinary projects of patient advocacy of SPAGN members. And we hope that this will be, for you, all of you, a source of inspiration and also resource, but it will also be an opportunity for us to recognize the excellence and this great work that is done by the SPAGN members. So what we will do this afternoon is we will have some presentations of best practices in sarcoma patient advocacy. We will have also the Advocacy in Action Award and also the Paola Gonzato Award winners. And we will have also a brief introduction of a young man who is doing a bike tour from Germany to India. And last but not least, we will have 10 years of listening, learning and impact, the Sarcoma UK support line. I'm Gabi Ott, I'm a member of the board of SPAGN, and I'm here with my colleague Ornella Gonzato, and she's also a member of the board. And now I turn over to Ornella, because when we talk about best practices, what do we mean with it? And Ornella will share some words with us about this. Thanks. Wait, David. Bravo.
Well, I'd like to briefly clarify the meaning of best practice in this session. When we use this term, we are not referring to theory or the abstract models, but to something much more concrete. Initiatives that have been proven to work in a real context under real constraints with tangible results. So best practice in this context is something that combines three elements. First, clear impact, something that has made a difference. Second, thoughtful execution. How that result was achieved matters as much as the result itself. And third, a degree of transferability, replicability, something that can be understood from others, that can be applied in other contexts. What we see heard today are three examples, selected examples, to illustrate these principles in different ways. We are interested not only in what was done, but how it was done. And so each of these examples is a great opportunity to learn from each other, not only to observe the results and achievements. And with this in mind, it's my pleasure to invite the first group. Here we are describing the three examples, one from Together Fighting Sarcoma from Bulgaria, Fondazione Paola Gonzato from Italy, and Synovial Sarcoma Foundation from US. And now it's my pleasure to invite Lydia from Together Fighting Sarcoma Bulgaria.
Okay, hello. Thank you, Ornella. I'm very pleased to be here today and to be able to share some information about the information campaign that we organized in Bulgaria. My name is Lydia Vitanova, and I'm co-founder and chair of Together Fighting Sarcoma. And why this campaign is so important? Because Bulgaria is far behind most of European and not only European countries in terms of sarcoma treatment. And this is why, because we still don't have an expert center. We have a very few medical specialists who knows how to diagnose and how to treat sarcoma patients. And we still don't have a clear pathway of those patients who are affected by sarcoma. And I'm doing this patient advocacy because nearly 5 years ago I lost my 15-year son from osteosarcoma, and I know very well what it is to be a patient in this rough journey. And I will never forget the nurse which told us in a clinic that our son was treated, that for 45 years no child with this diagnosis, sarcoma, survived. So when we found out our organization, we said that this would be the first step to organize this informational campaign about the sarcoma symptoms and how to recognize it and how to get earlier diagnosis. So the campaign objectives were exactly those: to make the road shorter from the symptoms to the diagnosis in order to get better treatment and better outcomes. And to improve the awareness not only between the patients, but between the healthcare professionals as well. So I had the pleasure to be selected from Bulgaria to represent our country in a Rare Disease Week that took place in Brussels, and to meet members of European Parliament. And in our organization, we decided to use this momentum and to organize such an awareness campaign exactly at this moment, because we were able to attract media's attention more easily and to talk about sarcoma in general. So you can see here our main visual that was used during this campaign. So the campaign itself has two directions. The first direction was the 3 videos that were exactly about the sarcoma symptoms. 3 years ago, when I was for a first time at SPAGN conference, I saw those videos and I was very attracted by them and thought that they would be very useful for the Bulgarian audience. So we did everything possible to get all the approvals in order to be able to adapt those videos in Bulgarian language and to broadcast them all over all possible channels. So we used social media and used the national channels, TV channels, in order to be able to get to more people. And the second line was media presence with not only representatives from our organizations, but with medical representative. We found those doctors who were aware of sarcoma, and we invited them to join us and to make these special interviews in specialized programs throughout the TV, radio, and websites. Moreover, we used the patient stories, success patient stories, in order to tell people that this disease is curable and there is people who can be cured from this disease. So you can see the results that we managed to achieve with our campaign. We used a mix of channels. It was social media, national TV and radio, specialized website, as I said, and public transport channels where the videos were broadcasted. Of course, we have a partner during this campaign, and we had a special rubric in one website which was called Portal Patient, where we made a dedicated column only for sarcoma, where we published not only information from a patient perspective, but the one and from the medical specialist as well, in understandable language. So you can see the coverage that we managed to achieve here, and we think that this way we made the pathway of the patients more easy and more directed. And not only the numbers are important here, but the thing that maybe you will say that when you have a budget or when you have the sources to do this campaign, it's easy, but the fact is that most of these interviews and broadcast and participations were done for free, and this was the contribution for the media to our campaign in order to be able to to reach more bigger audience. So it is feasible, it is manageable, and I believe that it was a very first good step for all patients in Bulgaria to be able to reach the expertise. So this was from my side, and I really believe that awareness is a shared responsibility. Thank you very much for your attention.
What were the key factors that made successful your project?
Well, the key factors for the success was the support from all sides, the support from the media, the support from the medical oncologists and the people who are familiar with the disease, the support of and the trust of the patient who told us their stories in order to be broadcasted. So all this support that we received during this campaign was the key factor.
Okay, thank you very much.
Thank you.
So now I would like to actually move to Italy, where the Fondazione Paolo Gonzato Rete Sarcoma has conducted the first national survey in Italy. It's called Living with Sarcoma in Italy, and from that survey on, they actually produced a white paper for sarcoma that is really leading to policy change in the country. So I would like to invite Martina Garlinzoni and to give us the presentation. Thank you.
So, good afternoon. Yes. Thank you, Gabi. Thank you for this opportunity to share our project From Patients' Voices to this Systemic Change, the Italian Sarcoma White Paper. And the title itself tells you everything that you should know, not just to listen, but to act. Firstly, why such a project? Our overarching goal was clear: to transform patients' and caregivers' experience data into actionable system-level policy proposals, not just a wish list, but a roadmap. And to do so, we set multiple detailed goals, from giving voice to patients and their families and caregivers, and generating evidence from data, to promoting knowledge and awareness, and supporting the implementation of the Italian Rare Cancer Network in the sarcoma domain. The how is built on 3 pillars, and that is what makes the project replicable. First, listening. We launched the first ever nationwide survey, Living with Sarcoma in Italy, for patients and caregivers. Second, analysis. We translated the survey insights and data into a strategic document, the white paper. Third, action. We presented the first ever Italian sarcoma white paper at the Chamber of Deputies in Rome and engaged with key patient groups, organizations, experts, and policymakers. It all started with the national survey Living with Sarcoma in Italy, which was specifically designed to capture patients' and caregivers' insights and experiences on their daily challenges and unmet needs, the diagnostic and treatment pathways, and the psychosocial and information support they received or did not receive, and their research priorities. Crucially, the survey was launched during the National Sarcoma Awareness Campaign by the Fondazione Paolo Gonzato to amplify dissemination, making sure we reached a truly national and representative audience. The survey results are at the basis of the Italian Sarcoma White Paper, which is divided into 3 parts. The first part covers patients' voices, both qualitative and quantitative data. The second part provides clinical and organizational insights from leading national Italian sarcoma experts. And the third part offers recommendations structured as a living roadmap. The document is freely downloadable from the Fondazione Paolo Gonzato website because we believe that access to this knowledge should have no barriers. So about the survey results, over the 3 months that the survey was available, almost 400 responders took part, which is a meaningful and significant sample for our rare disease population. Among the data gathered, 49% of diagnoses were incomplete or incorrect or inaccurate. So the second part of the white paper integrates the patient data with the perspectives of some of the main Italian sarcoma experts. It covers sarcoma types and epidemiology with the particular attention to pediatric and adolescent patients and to subtypes such as uterine sarcomas. It examines research gaps and patient involvement, and it addresses the key aspects of psycho-oncology, emphasizing the need for humanized care. Lastly, it includes also an overview of the role and function of the specialist centers and networks, drawing on SPAGN's international consensus document on Sarcoma Intelligence Specialist Network. So the third part is where the white paper becomes a practical tool for change. Based on the survey data and on the structured consultation with the patient groups, clinicians, and researchers, it outlines the main critical issues and formulates 14 recommendations ranging from molecular testing, diagnostic accuracy, to research investment and patient involvement in governance. This is not just a document written about patients, it is a document built on patients' voices for a system change. The white paper includes also clear and accessible infographics on sarcomas and specialist centers. We wanted to make sure that this is not just a policy tool for institutions, but also a resource that patients and their families can actually use. So where did we bring this work? The white paper was officially presented at the Chamber of Deputies in Rome under the patronage of the Ministry of the University with an opening message from the Prime Minister. The institutional setting mattered enormously, placing sarcoma care at the center of national policy attention. The presentation was followed by a national press conference and extensive media coverage, and the total readership was about 47 million people. For the first time ever in Italy, sarcomas were front-page news. In terms of timeline, the survey was launched in June 2023, and the white paper was published and presented in June 2024. Now we're in the implementation phase, translating the recommendations into concrete projects. Currently, 2 implementation projects are underway. The first one relates to healthcare system organization, which aims at strengthening regional oncology networks and a national rare tumor network. And the second one relates to psycho-oncology and the humanization of care. So, in conclusion, this project demonstrates that it is possible to elevate sarcoma care from clinical invisibility to a matter of national policy. It is the first structured policy-oriented project ever developed in Italy on sarcomas. It is a participatory governance model built from the bottom up, yet endorsed at the highest institutional level. And we believe it is a scalable and replicable initiative for other countries and other rare cancers and disease. Lastly, last but not least, the main challenges we encountered. Obviously, transforming an idea into a clear medium-term strategic operational plan is harder than it sounds. Organizing at national level is definitely requires organization, precise orchestration, and a lot of patience. Also, because of engaging with the different parties and stakeholders, each with their own priorities. Thank you for your attention.
So thank you, Martina. Well, I think this must have been really a very complex process, and it certainly is an impressive result. But tell me, what were really the biggest surprises along the way for you?
The biggest surprise was probably the survey participation, because 400 respondents in just 3 months. It's a huge result. It means that the survey was well conceived, it was well executed, and that made the overall success possible of this project. And also this uptake in such a short time, I think it speaks to the leadership role that the Fondazione has in the Italian sarcoma community.
Thank you.
Thank you.
So, and now we move over to the United States. And really, I have the pleasure to say that we will listen to the story of a breakthrough initiative on collecting real-world evidence for synovial sarcoma. So I invite Julie Kramer from the Synovial Sarcoma Foundation to give us the presentation. Thank you. Yes, this is for just away from you.
Testing. All right, hold on. This is kind of loud. I talk loud, sorry. Good afternoon, everyone. What an incredible opportunity it is for me to be up here speaking with all of you. I must real quick thank Nathan, the chairman of our board, who is here today, and the founders of this foundation, Chas and Laura Spence, who are not here, for allowing me this opportunity. That seems like a dream come true. I feel very fortunate, and I can certainly say that 12 years ago, if you told me that I was going to be up here doing this, I wouldn't believed you, truthfully, because I didn't think that I would make it here. For those who don't know me, my name is Julie Kramer, and I was diagnosed with stage 4 poorly differentiated synovial sarcoma at the age of 23. I had a 20 centimeter wide tumor, watermelon sized, compressed against my left lung. I underwent chemotherapy, surgery, and proton radiation, and after 2 recurrences of this disease, I can happily share that I am no evidence of disease for 9 years. Thank you. Unfortunately, that is not the case for everyone, and I'm sure that everyone in this room knows that. That is why myself and everyone at the Synovial Sarcoma Foundation are pushing to change. That is why the foundation has established the first of its kind synovial sarcoma biorepository and registry program. Technology. Sorry. Oh, lovely. Thank you so much. Like most sarcomas, synovial sarcoma is rare and aggressive with a poor prognosis. That's why it's so important to better understand this disease. When I first consented to donate my tumor through my institution before I had surgery, I often wondered whether the tumor was actually being studied. Samples were being collected at different institutions, but there was no central place to bring them together for research, until now. Thanks to the Spence family, which without them, this registry would not exist. After their son, Callan, was diagnosed with synovial sarcoma, Chas and Laura Spence committed to building the research infrastructure this disease never had. They funded the first $1 million US dollars themselves and through their network, and stayed deeply involved in every part of the work since. The registry is IRB approved, meaning it has full ethics oversight. It also collects prospective, so we enroll patients and follow them over time, collecting data and samples as their treatment happens. That's different from a retrospective registry, which looks back at past patient records. Ours is based on the CHOP pediatric brain tumor registry model, which has also allowed CHOP to set it up so quickly. The registry is powered by 3 categories of research, the first being internal research. The current flagship of this work is led by Dr. Rachel Hurley, a foundation-funded scientist working in the Halder Lab at Penn. She's using our registry samples to ask 3 questions. The question to highlight is the third: how tumors change under treatment and develop drug resistance. This question can only be answered with multi-time point sampling, meaning samples taken from the same patient at multiple points during their treatment. Most registries don't capture that. Ours does by design. The next area of focus is external research. Academic and industry partners can now request and access centralized data and samples, something that has not been previously existed for synovial sarcoma. We've also established the first international synovial sarcoma tumor board, bringing together over 196 experts across 84 institutions worldwide to review cases, share insights, and improve care. This effort directly supports and strengthens the registry by bridging the gap between doctor and patient communication. And I just want to point out that in this picture is Eddie in front of me, and he's also a patient on the registry, including myself. And he's currently NED too. Most synovial sarcoma data sits locked inside the institutions that collected it. MD Anderson alone holds a retrospective database of approximately 1,400 synovial sarcoma patients going back 4 decades. The data set has never been linked to outside resources. To change that, we've funded a PhD-level research director to integrate outside data sets like that one and develop the research questions our combined data can answer. The output we want is published research, not just data access. Most hospitals and oncologists don't refer synovial sarcoma patients to a central registry on their own, so the recruitment has to come from us. Our online community is where most of that work happens. Once a patient consents to participate, 3 foundation-funded research staff at CHOP take over. They collect medical records, imaging, tumor tissue from whatever hospital is treating that patient. Tissue is the hardest part to collect. We prioritize flash frozen, meaning tissue frozen within minutes of surgery before it degrades. It preserves more of what researchers can study than the standard method hospitals use, called FFPE. Every sample in our biorepository got there because a patient said yes, and we chased them down. Not literally. Literally. So right here, this slide highlights the current scale of our data and how these samples are being actively used in research. We are developing models like PDX and organoids, advancing single-cell analysis, and exploring how the immune system can be leveraged to treat synovial sarcoma. At the same time, we're supporting broader efforts like a pan-sarcoma publication, piloting FFPE-based studies, and identifying new targets for cell therapies, including proteomic and RNA sequencing from archived tissue. Looking ahead, we're focused on 4 priorities: expanding patient access to clinical trials and genomic studies, opening additional enrollment sites, including international, integrating retrospective data from partner institutions, and continuing to invest in our internal research efforts to drive published science. This initiative represents a critical step forward in advancing research and improving outcomes for all patients affected by synovial sarcoma. A diagnosis like this comes with so much uncertainty. Many patients don't know what their future will look like, or if they even have one. 3 years ago, I gave birth to my son, Miles, after not freezing my eggs prior to treatment to avoid delay. He's my miracle. And I'm forever grateful to the care team that I have that helped save my life so I can bring more life into it. This registry exists to give patients like me a chance not only to survive, but to live their own miracle. Thank you.
Julie, just a question. What was the biggest challenge you encountered?
I would say the biggest challenge we have encountered is gathering as many patients as we can to consent to the registry. There have been hesitations, and we try to, again, bridge that gap. That's also why I came into the picture, to kind of create a patient-to-patient relationship, to build trust and build a relationship and a connection with those patients, to let them know they can come to our foundation, they can trust us, and this is something that we're working on together, and also letting them know where exactly, what's being done on their tissue, letting them know, this is what it's being used for, and even if you're no evidence of disease for 10 years, 20 years, you're still making a significant impact.
Okay. Thank you.
Thank you. Thanks.
So, and now I would like to announce the results on behalf of the SPAGN board of the Advocacy and Action winners. A jury of healthcare professionals and patient advocates reviewed the submissions this year. And I bet the work wasn't easy, because there must have been really many beautiful projects. But as it is, there are only 3 prizes. The third prize is 1,000 US dollars, euros. Oh, it's different. 1,500 for the second, and 2,000 for the first prize. So, and I would like to announce that the third prize goes to the Sarcoma Symptom Awareness Campaign, the first national sarcoma awareness initiative in Bulgaria. Okay, yes. Thank you. And the second prize will be presented to the Fondazione Paola Gonzato, Rete Sarcoma, From Patient Voices to Systemic Change, the Italian Sarcoma White Paper. Congratulations. Come. So. Okay. Thanks. So who's the winner? The winner is the Synovial Sarcoma Foundation, Synovial Sarcoma Registry, and Biorepository Initiative.
Thank you so much. Oh my God, thank you. Can you get in? Get in. I have to, he has to, he has to.
Okay, but okay, I'll congratulate you already.
Thank you so much.
Thank you. And now I would like to turn again to Ornella, who actually has been really generously funding the Paola Gonzato Award for, I think, 3 years in a row now. And she will take over this part. Thanks.
Thank you, Gabby. I'd like to say just a few words about this award, which holds a deep personal meaning for me. This award is in memory of my sister Paola, who passed away from an osteosarcoma. Through her journey, I experienced firsthand the many challenges this disease brings, from limited treatment options to complex surgery, intensive rehabilitation, as well as the impact on psychological well-being and quality of life. This experience has shaped who I am. It's the foundation of my commitment over the past 20 years in patient advocacy, working to ensure patients are heard, their needs are recognized, and their perspective is truly integrated into research, care, and decision-making processes. And this is also the essence of SPAGN, which I would like to sincerely thank for embracing my initiative to establish this award specifically dedicated to the bone sarcoma community. For this award, I received 2 outstanding projects. One from the Polish Sarcoma and Melanoma Patient Association and Institute of Mother and Child, and the second from the EuroU in partnership with Bone Cancer Research Trust. The first project offers a meaningful contribution for caregiver support, psychological support, by addressing the emotional burden and strengthening the child's support system. It creates a more stable environment for pediatric children. This initiative highlights something profoundly human, the need to care not only for children with cancer, but only for those who care for them. And it brings us a profound meaning and for a more human approach in sarcomas, but more generally in oncology. The second project emphasizes the meaningful involvement of patients and patient advocates in the research process and their collaboration with the key stakeholders. It goes beyond support alone, aiming instead to influence how research and care are designed and delivered. So both projects are absolutely impactful, and they are driven by the same commitment to improving patients' lives. The difference lies in their approach. One strengthening the care environment around the patient, and the other empowering patients within the system itself. And for this reason, it's my pleasure to recognize the second project as the one that most strongly embodies the essence of this award. So the winner of the 2026 Paolo Gonzato Award is the project presented by the Ewing Consortium together with the Bone Cancer Research Trust. And thank you to both teams for their outstanding projects, and congratulations to the winner that I invite to share with us this project.
I think I'm number 2. Hello? Hello? Oh, hello. Hi, everyone. My name is Sylvia. I'm here on behalf of Bone Cancer Research Trust. Thank you to Ornella, and also just thank you to you all. And I'm really excited to present about our work as a charity and our involvement with the Ewing's Consortium and how bringing patients into that can make a massive difference. So just a bit about us. So Bone Cancer Research Trust, it is our 20th anniversary year, so we're very excited about that. And our mission is to save lives and improve outcomes for people affected by bone sarcoma in the UK through our strategic pillars of research, information, awareness, and support. And before I go any further, none of what we do could be possible without the support of our patient community, whether that's going on live TV and spreading awareness, whether that's running marathons, collecting stamps, participating in our horse riding challenge. They are at the core of absolutely everything we do as an organization. So as I mentioned, I'm going to speak about how it all kind of comes together, right? How us as a charity, the Ewing Consortium, collaboration, patients, how that all kind of fits into the wider piece of creating better outcomes. So just a bit about our charitable investment to date. Since we were founded, we've awarded 38 projects focused on Ewing sarcoma specifically. Very excited that we've committed another $3.2 million in projects. And just pertaining to this specific example, we fund consortia with the Ewing's Consortium. We also help fund some clinical trials. As a small charity, we can't fund them outright, but we do support trials through some top-up funding. And we also have facilitated some project grants for biological studies to support clinical trials. I'm going to specifically be speaking about Recur in this presentation, but those are just some examples of what that research investment looks like. So how we involve patients at BCRT, I'm conscious that this might be quite difficult to see, but they're involved. A big important bit on how we got here with our Ewing's research investment is having our patient community help us identify priorities, also helping to develop applications. The bit in orange is how they're involved in the clinical studies themselves, so helping design that research, providing feedback during that trial process, helping to disseminate findings and also evaluate research and participate in lay grant reviews as well. As for the EEC, so the Euro-Ewing Consortium is a organization of a lot of different people, so clinicians, scientists, patient advocates most importantly, and the charities to improve survival and quality of life for patients with Ewing sarcoma through that really strategic collaboration. This photo was from the EEC network meeting, I believe last year, on a very hot day in London. And the EEC Executive Committee leads the consortia, and it's also supported by us, BCRT, and the Ewing Sarcoma Research Trust. So how their patient experts are involved in the EEC, specifically through a variety of different activities, such as influencing strategy, sharing information about the EEC with the wider Ewing sarcoma community, presenting at the EEC network meeting, other meetings and conferences, again, that feedback and input into trial design, and also review of patient information for clinical trials. So about the RECUR trial specifically, so this is Professor Martin McCabe out of the University of Birmingham. So RECUR is an international randomized controlled trial of chemotherapy for recurrent and primary refractory Ewing sarcoma. And the aim of this specific trial is to compare the different chemotherapy treatments that didn't respond and looking at what's most effective or has the fewest side effects, and is a very large trial. So from 2015 and then looking ahead to 2027, there's an estimated about 700 patients that are a part of this trial. And I think a really good example of patient advocacy with the EEC specifically is looking at a promising drug that demonstrated clinical benefit in patients, and through a really successful and meaningful collaboration between the EEC, those patient advocates, collaboration with the clinical teams and also with the pharmaceutical industry, you can see there that there is going to be an additional arm to this specific trial through that patient involvement and that successful collaboration with wider stakeholders. And that's just kind of how it all comes together. So there's the Euro-Ewing Consortium and then also the Advances in Ewing Sarcoma Research Network that we also, as a charity, help facilitate. And there's a variety of different projects and initiatives that both of these entities are a part of, and how they interact, and that we support financially and in other areas as an organization. And just a call to action here, the summer Ewing's sarcoma meetings include the Advances in Ewing Sarcoma Network meeting and also the 2026 Euro-Ewing Consortium meeting. Both of the abstract submissions, I believe, have closed, but registration is still open if you scan that QR code. The AESR meeting is a bit more kind of research heavy, geared towards that clinical community, whereas the Euro-Ewing Consortium brings together the researchers, the charities, the healthcare professionals, and most importantly, the patient advocates all together in one room. So if you are interested, please scan that QR code. And thank you so much for listening. And again, thank you to Ornella for the award. Thank you. Thank you. Thank you.
And thank you to Bone Cancer Research Trust and the Euro-Ewing for the great commitment to the bone sarcoma community.
Thank you. Thank you.
before we move to the final presentation of this session, I just wanted to use the opportunity to inform you about an interview that we just published today on the Voices of Sarcoma blog. This is John Müller from Germany, and he is a Ewing sarcoma survivor. John has actually been, I think, treated for 10 months, was in hospital. He participated in a clinical trial, and he is now almost 3 years with no evidence of disease. So I had really honored to have an interview with this exceptional young man, and he said that when he was still in hospital, he said to himself, if I ever get out of this, I want to return something. I want to fulfill my dreams, and I want to return something. So what he actually did is he fulfilled his dream, because his childhood dream was that he would ride by bike to India. Actually, one must say he's really an athlete. No? He's an extreme sportist. No? But of course, he said one could fulfill the dreams, but maybe in a different way. So what he is saying is he's fulfilling his dream, but he is actually riding for those who can't. And he also, because he has witnessed it himself, he has seen that there's so much hardship around sarcoma, and particularly adolescents and young adults, they have really a lot of problems, that they fall through the cracks. So what he's actually doing, he's going on a charity tour. These are around 8,000 kilometers, and he wants to raise funds for an emergency fund for those particularly young patients and sarcoma patients. So why am I saying all this? Number one is that, of course, you can read the full interview on the blog page of SPAGN. But actually, more importantly, is that we are really soliciting your support as John is traveling by bike. He's starting on 8 May in Germany. He's going through about 15 countries, and he will come through countries where also member organizations are based and located. Like we start with Germany, Austria, Hungary, Bulgaria, Serbia, Turkey. And then it goes on with, maybe we don't have representatives there, but Uzbekistan, Tajikistan, Pakistan, India. So what he actually needs is, he needs contacts, he wants to meet people, he wants maybe also help to organize meetings in hospitals, with the media. He will also need food and shelter. He's autark, no? But he's traveling with a tent, but still, if there's a possibility, please, you're all most welcome, and you can see on our website there's the link to his website. He's also on the Instagram channels. It's 8,000kilometers.live. There you can follow his route and also see where he will be. And of course, also you can donate. So I wanted to really do this small fundraising appeal. Thanks. And now I'll hand over to our colleagues from the UK, Carly MacDonald and Sam Hackett, and they will walk us through 10 years of UK patient support hotline. Thank you.
Thank you.
You want to?
Testing? Hi everybody, my name's Carly. I've been lucky to meet many of you already, and I'm here today with Sam, here. And Sam and I work in the support team at Sarcoma UK. Thank you to SPAGN for this opportunity to speak today. We'd love to share with you what we have learned and how things have developed over the last 10 years since the Sarcoma UK support line opened. So I know many of you will already be aware of the charity Sarcoma UK, but we just wanted to recap on the 3 main objectives of the charity, and these are reflected in our very new strategy. So we work to ensure that everybody diagnosed with sarcoma has equal access to quality support, care, and information throughout their entire journey. We want to improve care pathways and patient experiences and outcomes for everybody affected by sarcoma. And we want to enable patients to live longer and to live better by funding more sarcoma research.
Can you all hear me? Yes. When we set up Sarcoma UK support line, the Sarcoma charity, as you know, we'll all know, was founded by the amazing Roger Wilson and Sheila. And I always, when we started the support line, had their passion and their drive in our minds. It was 2015 when I joined Sarcoma UK. I'd been a clinical nurse specialist at the Royal Marsden for about 18 years. As you can see, I'm getting on a bit now. And it was a small charity then. There was only 8 of us, and I think we're at 32 people now. And the office team at the time were starting to get an increasing number of phone calls of things that they finding really hard to answer, more complicated. People were finding it really hard to understand where they should be going with treatment and options. And so the Sarcoma UK support line started with me and one other girl who used to help out on a Friday. And I genuinely think that on the 8th of April, 8th of February in 2016, the first phone call was one of Roger Wilson's mates that rang just to make sure someone rang for me on that first day. He denies that, but I'm really sure it's someone he knew. But the reason we wanted the support line was we always felt when you're clinical, we didn't have very much time. We'd be running around like lunatics on the ward, and we really wanted somewhere where people would have the time to ask those questions that were important for them. And we wanted to provide a listening ear that was impartial but experienced. I really wanted people, when they rang, to say, oh, I've just been diagnosed with sarcoma, and for them to hear me go, oh yeah, yep, I know about sarcoma, and if I don't know the answer, we absolutely will go and find out that for you. And we really, really wanted to make sure that people were being cared for by a sarcoma team. And that's so crucial. We're very lucky in the UK. We have a specific pathway. It's been around for a long time. That doesn't mean that people are always following it. And so it was really important for us. We asked this question, are you under a sarcoma MDT? And we've done that for the last 10 years, and we've moved over 200 people to make sure they get into the right sarcoma team. And it's always been confidential, always been there for people just to ask what's important to them. And we've always had every single question I would have had clinically, and then loads more. When you're a clinical nurse, you also have your own agenda. You have lots of information that you need to give the patient. On the support line, we literally pick up the phone and we listen and we answer the question that's important for that caller. We were clear at the beginning about boundaries. It's always really important when you're setting up a service that you know where your boundaries are and that you help everyone else know. So we're not a second opinion. We don't offer a second opinion. We're not qualified to offer a second opinion, and we've never done that. And we're not an acute service. Someone rings us and says, I don't feel very well. I think I've got a temperature. Ooh, they need to hang up on us and ring the clinical team as soon as possible. And we've always been really clear about that. And we chose never to have clinical notes. As a nurse specialist, you rely quite a lot on what the notes are saying, what everyone's been talking about in the ward round. We never wanted that, because we really wanted people to ring and ask the questions that were important for them. What do you have that you haven't been able to get answered? What are you still trying to work out in your head? And we didn't want any clinical notes. We just wanted to hear from the person that was ringing us. And we've had very clear guidelines, and we are NHS background, which means we have SOPs and guidelines of what we do, but that's important. We need to know when to escalate. We need to know when to reach out. And within the charity, we have very clear guidelines of what to do. If we are very genuinely worried about that caller, what should we be doing? And that's very clear. When we set up, like I said, had a lot of advice by very important people like Roger and Ian Judson, who was a clinical oncologist, oncologist that I worked with at the Marsden, but was also part of our trustee board. And he said at the very beginning, you really need to build the relationships with the clinical teams, which we've done. And we work very closely with the clinical teams across the country. And that's really important, because if someone's ringing in from, I live in Somerset, down in the southwest, so Yeovil, which is a town down there, and saying, I think I've got sarcoma, where should I go? We know exactly where they should go. And we know that local team in Bristol really well. Or we know the team up in Leeds. We know them. We know exactly where they should go. And we did a lot of work, and we continue to do that work so we can do that. We also do a lot of projects with the clinical teams. We, have always done that because we want them to understand that we do have a lot of knowledge and expertise, but we also need their knowledge and their expertise, and it's a partnership. And we offer a lot of support to the clinical teams now because we've worked alongside them for a long time. We really support new starters to sarcoma services in the UK, people who are working on their own as a nurse or a physio, even an oncologist sometimes, that are a part of an MDT, but they perhaps are the only person in that specialty. And we've also worked together collectively on challenging cases that might mean involve an MP or the government, and some of that work my colleague Andy will be talking about on Sunday. And we have a medical advisory board, which we kind of call our back office, but I mean they are the Robin Jones of this world who's talking tomorrow, so they're very senior. But we see them as our back office. So if there's a question that we can't answer, we go out to our medical advisory board and ask them if they can answer it for us. I just say this, and then there's one last slide before Carly swaps, is that we added it up the other day, and we have over 140 years of sarcoma experience between us on the support team. And I think that's really crucial. We've always tried to make sure we had that expertise so that we were feeling that we were in a strong position to answer those questions.
Yeah, and just to add to that, when I joined the charity in 2020, there were 3 of us in the support team, and there's now 8 of us. So it just shows you, how things have grown over the years. So in terms of operations, we're currently open Monday to Friday from 10 till 3. And over the years, we have extended those opening hours in response to what we found through our own internal audits and also feedback from contacts to the support line. Our details are shared by the clinical teams, and people often find us through internet search as well. We currently offer for people to contact us by free phone, email and text message, and we do have a voicemail service if we are on the line already, and also we do a lot of callbacks, so we schedule people in for calls, usually around the timing of their appointments. We are paying attention to people's needs and wishes, so we're currently looking at ways to increase the number of ways in which people can contact us, offering things like WhatsApp, for example, and web chat. We also found a couple of years ago now that people were going through to our voicemail service. So to try and decrease the number of calls going through to voicemail, we now have 2 members of the team available each day to take calls. We're not linked to a clinical team, as Sam's alluded to, but we do have good access to them if needed. Over the years, we have been reminded of the importance of our advocacy role. So we often say that we give people the tools to advocate for themselves. So things like, as Sam mentioned, using those words, have I been discussed in a sarcoma MDT? But in more recent years, we've actually stepped in. Rather than giving people the words to advocate for themselves, we've actually contacted clinical teams directly ourselves when patients and family members are finding it difficult to navigate. And as Sam says, we've now moved more than 200 people into sarcoma specialist centres to make sure they are in the right place and getting that specialist care. A big part of our role on the support line is helping people to come up with questions for their clinic appointments, because we know that actually that really helps when they're in those consultations. There's so much information being given to them, but actually they need to ask those questions that are important to them. We're also there as a sounding board. We've got that time. We're so lucky to have that time to be able to listen to people and to listen to their concerns. And we can also offer that reassurance. If they're in the right place and things are moving along as we would expect, we can offer that reassurance. So in the first year that the support line was open, there were 947 contacts from 419 individuals. As of the 31st of March this year, we have had over 32,000 contacts with more than 7,000 individuals. So it just shows you how the service has grown over the years and how we're reaching more and more people, which is, fantastic. And we really have learnt the importance and the value of collecting data, using this to kind of monitor our reach and also to grow the support team as we have done. So who contacts us? People directly affected by sarcoma and complex benign tumours. Their family members, often parents. We have lots of parents that reach out to us for support. Friends, colleagues, teachers, anybody really. The public will contact us often in that sort of I have a lump phase. They may have a lump or a bump and they just want to talk about that. They may have typed it into an internet search and sarcomas popped up somewhere, so they contact us, and also healthcare professionals. And over the years, we've spoken to many members of the same family, so we might speak to mum, to dad, to grandparent, to sibling, to neighbour. It really does go on. In terms of reasons for contact, so again, we do internal audits to be able to monitor this. So emotional support is one of the reasons that people contact us at any stage in their sarcoma pathway. Treatments, people often want to talk about treatment options. They want to ask about clinical trials that might be relevant to them and access to drugs. We have lots of calls from people at the point of diagnosis, so when they're trying to make sense of that diagnosis and the road ahead of them. And for the last couple of years, we've found in our audits that we've had a greater number of contacts from individuals in that pre-diagnosis phase. And to us, that's really encouraging because as a charity, we're doing a lot of work around raising awareness of sarcoma. The Direct Referrals project is a project I took on when I joined in 2020. And this came as a result of our work on the support line. We realised that expanding our reach is vital so that we can support more people. So we launched the Direct Referrals service. And this involves the clinical teams referring patients and sometimes family members directly to us on the support line. We then make that first call out, usually a week later after receiving the referral, because we know how difficult it can be for some people to call a support line. So this is working really nicely. We're reaching people who may otherwise not reach out for support. We call and offer additional support, working alongside the clinical teams. We're able to signpost as well. And we've now received more than 800 direct referrals. Support groups also comes under our remit as a support team, and through our work on the support line, we've realised the value of peer support, and so we spend some of our time guiding the support group leaders. So although we don't lead the support groups ourselves, we guide the support group leaders, most of whom are patients themselves, supported sometimes by their family members, and sometimes it's the clinical nurse specialists leading the groups. So we've currently got 24 support groups across the 4 nations of the UK. Some are for specific subtypes or groups. For example, we have a group for parents of children with sarcoma. We run twice yearly support group leaders catch-ups, and one of those is in person. So on that day, we invite external speakers. For example, we've had a psychotherapist deliver a session on self-care, so we know that the support group leaders are aware of the importance of looking after themselves when doing this vital work. And we spend time having discussions in small groups as well about the highlights and challenges of running support groups. We also, through our work on the support line, identified that there was a gap in peer support for those who are bereaved because of sarcoma. And we really wanted to address this. So we have now set up an online bereavement support group. This was launched in July last year. We felt that these groups should be led by us as a support team because of the sort of delicate nature of the groups. And we've now set up 3 groups. So we have a group for parents who have lost a child under the age of 25, and we have a morning and an evening group as well. Community Days is another project that we as a support team have led on. So we speak to people all the time on the support line who say to us, can you connect me with somebody else with my type of sarcoma, or can you give me some hope? And this was a huge driver for us sort of relaunching the Community Days. And we hosted 2 Community Days last year. We invited expert speakers. We had patients sharing their stories. We had some wellbeing activities, and it was an opportunity for people to find peer support as well. It's also a great way of networking and raising awareness of the work of Sarcoma UK. And it was great that 65% of people that attended the Community Days were new to the charity. And we were really pleased with some of the feedback that we received, particularly that one there that said the day was filled with hope, because that's what we really wanted to achieve.
I think the one thing that maybe surprised us is that when we set the support line up, we were really clearly thinking about being available to answer the calls of the people that rang. So what could we support the patient and the families with? But actually what we found is it's a two-way information stream, and we ended up in this kind of amazing, unique position that we were having daily updates from everyone in the sarcoma community in the UK, a little bit internationally, but we send all our international calls to all of you. And so when you're a nurse in a clinical team, you know your patch really well. You know exactly what happens in the hospital you're in, but you have no idea what's happening in Leeds or Newcastle because you're so busy doing the job. But the support line's been really different because we have phone calls from people across the whole country, and we've been able to pick up trends, difficulties in pathways. So a particular issue, for example, we picked up with angiosarcoma of the breast. So those patients actually, we thought their pathway was quite quick because they ended up going to the breast teams, and then they would find our way here, but actually they end up with the breast teams and they weren't finding our way to the sarcoma teams. And we were able to take that back to the clinicians and go, this is what we've seen with our 30,000 contacts of the 153 angiosarcoma of the breast patients we've spoken to over the 11 years. This is what they told us. We had this kind of data that we weren't expecting. And that's great that the voice of the community came back to us, and that then we could really look at that and think, what could we do with it? So my role changed. I was on the support line for 10 years, and then last year I changed and I came off, and I'm doing a lot of support stuff, but a lot more health professional engagement as well. And it was really to try and make sure that what we've been hearing on the support line for the last 10 years, we do something around, that we take that voice of our patients and carers and we take it and do something with it, and we raise awareness in a much stronger way. So we've been doing all sorts of things. One is around taking it into policy, UK policy, and Andy will talk about some of our State of the Nation work that we've done. But when you're in front of MPs, I used to be a bit nervous, I'm not anymore. I hear 10 years of all of those patients' voices and everything they've told me. And when someone says, well, the pathway is okay, I'm like, no, it isn't. This is a big issue. Let me tell you, I've been listening to people for the last 10 years, and we need to give you that information. I want you to make a change. So we've been doing a lot of work around policy. The GROW project is something as well that we do, and Carly spoke a little bit about that. We know, and I'm sure you all as charities as well will think the same, it's really important for us to get hold of patients really early on in their pathway, because then we can help. So the earlier we can grab patients, the more we feel we can help. And we've done a lot of increased engagement. I'm out talking to GPs, we train GPs, we train people training to be GPs. We're talking to medical students all the time. We are looking at the diagnostic services in the UK and trying to speak to them early so that when they are seeing people with a sarcoma, they know about us. The support team as well, we do a lot of education and raising awareness generally. So like I say, we've been doing medical students, GPs, we've done a lot of kind of anyone who'd like to hear from us. So the tax governments, the judicial teams, HMRC, we literally will speak to anyone in Sarcoma Awareness Month that wants to hear about sarcoma. That's big on our agenda. And for me, I really wanted to upskill the nurses that are perhaps not looking after sarcoma teams. So they're not the sarcoma specialist teams, but they're working on the ward or they're working in the community. I wanted to really think about how we could engage with them. So we've been doing something called the Spotlight on Sarcoma Day. We did it last year with the team in London, and we asked people who were caring for sarcoma patients but not in the specialist centres to come, and we funded that day, and it was great, and we had lots of discussions. We wanted 75 people, we had a waiting list. I only knew 4% of those people there. Everyone else was brand new. They were all people that I want to inspire. I need to get them in to the world of sarcoma and keep them there. So we've been really trying to engage the community. There are a lot of nurse specialists and pathologists and maybe a few oncologists in the UK that look a bit like me and are towards the end maybe of their careers. I've been in the game for 30 years now, and I want to inspire the next generation, and that's come from what I hear on the support line. Many of you might remember this amazing lady called Tricia Moat, who was an incredible patient advocate for sarcoma. She also was a palliative care nurse, and when she died, we set up an award for her. So we've been running that program for 6 years now. And we also have another one called the BSG Lotto, and we're very fortunate many of the pharmaceutical companies help that. And that is, again, about getting people into the conferences, engaging and inspiring healthcare professionals. Because you can't have specialist teams unless you've got doctors and nurses and physios and pathologists that are really fascinated and want to stay in sarcoma, and it's a big issue. So we're doing that too. I talked a little bit about this. Lots of what we're learning on the support line goes straight into informing our policy, trying to make a difference at a bigger level. And Andy will talk about this. But I think when I look back and when we really talk about 10 years of the support line, it was very much set up for the patient, and it has been an incredible kind of flagship for us. And I know in the room that the Irish support line is opening next Tuesday, which is amazing. And I think what I didn't expect was the impact the support line has had on the charity. It's brought us patients and voices that we do a lot of work with. It's involved people in policy. We've had so many people from the support line involved in our campaigns. It's given us 8 people now that have over 140 years of clinical expertise in the charity, which is awesome for a lot of the work we do. But all those people that ring us, so many of them also help fundraise. And I don't have the figures, but I think over the years we're probably cost neutral, which is incredible. And it's given us this incredibly unique kind of perspective on the world of sarcoma in the UK that I never expected that we would have. Thank you. Are you happy?
Just thank you very much for sharing with us this terrific experience. Congratulations.
Thank you.
Just a note in conclusion. I'm very honored and very proud for co-chairing this session, because this is an opportunity not only to share experiences, not only to learn from each other, but it also reinforces the feeling of belonging to a global common home, our sarcoma community. Thank you all, and congratulations to all the winners. Bye.